Bonjour. Always has to do an opening in a good way. We can start. I'd like to say, Chinigwich, that great spirit, bring a good day, a beautiful day, allowing us to come together and sit as family, sit with love in our hearts. Say Chinigwich to grandfather son for warmth, for light. Chinigwich to grandmother moon for controlling the waters, especially those waters of life that we all come from. Chinigwich for all the creation, two-leggeds, the four-leggeds, crawlers, the flyers, the swimmers. We say big witch for that. We ask you to join us, as always. Bring love to our hearts so we can do good things for our communities, for our families, and spread love. Say Miigwech, 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 all my relations.
Thank you, Kevin, for grounding us and starting us in a good way. We're gathered here today in the Lodge at Native Child and Family Services of Toronto, a sacred space for us built with community for community. And it's a real honor and a privilege for me to have the opportunity to welcome Honorable Carolyn Bennett, the Minister of Mental Health and Addictions and the Associate Minister of Health here at Native Child and Family Services today. I just want to share a few introductory words before I invite the minister up to the podium. And really, I just for those of you maybe who haven't had the opportunity to stand next to her at a podium, or maybe haven't entered her name in Google as much as I have, I do want to acknowledge some of the work that Minister Bennett has done within the context of both health and supporting Indigenous people. I think in 2003, in the wake of SARS, Carolyn Bennett was appointed the first ever Minister of State of Public Health in Canada. I learned actually quite recently that in those 2 years in that role, she set up the Public Health Agency of Canada, appointed the first Chief Public Health Officer of Canada, and also established the Public Health Network, which really enabled our province and territories to work closer with the federal government to safeguard the health of Canadians. After all of those significant achievements, Minister Bennett moved on to really lead a lot of the work that the federal government was doing with Indigenous governments and Indigenous communities. In 2015, she was appointed the Minister of Indigenous and Northern Affairs, and in 2017 became the Minister of Crown Indigenous Relations, a post that she held until stepping into something again that had not been done before, and really that's being the first and current federal minister of Mental Health and Addictions and Associate Minister of Health. I think I want to mention those two things because what we're doing here today is really acknowledging some threads of those work that demonstrated commitment to ensuring that we do our due diligence in supporting the healthcare of all Canadians, and also that the government works to sort of move forward in ways that honor reconciliation and continue to work better with Indigenous people. As people in Canada continue to struggle with the impacts of COVID-19, I think that we can say that from coast to coast to coast, those impacts are being felt at disproportionate rates by Indigenous peoples, right? And among the many intersecting challenges that the pandemic has made more acute, few are impacting Indigenous people more, particularly here in Toronto with the communities we serve, than mental health and substance abuse and addictions. And targeting those intersected challenges in ways that are sustainable and holistic is exactly what the Substance Abuse and Addictions Program is going to help us achieve. This funding, and I'm not going to say too much more about it, but I do want to say that it enables Native Child to deliver really essential health-based harm reduction services that are reflective and co-developed with the community we serve. So with that, I just want to thank Minister Bennett personally, for her long-standing commitment in this work. Thank her for an ongoing partnership with Native Child, and welcome her up to the podium. Thank you very much, Minister Miigwech. Yeah, thank you.
Thank you, Jeff, so much, and Melissa, and particularly Kevin, for starting us in such a good way, and reminding us of really the strengths that we all hold, but the humility the sun and the moon and all of these things that are bigger than us, and yet we count on them every day. And so I too want to acknowledge that we're in this beautiful lodge of Native Child and Family, and on the traditional territory of the Mississaugas of the Credit, where we honor all of the Indigenous peoples who paddled these waters and whose moccasins walked these lands. And I always feel here in Toronto that we are blessed by all of those beautiful diagonal roads in my riding of Davenport and Vaughan, and all of these that actually remind us of those pathways that the first peoples walked. And I think really this morning it is the humility of us being able to acknowledge that today we're really talking about prevention and about really the medicine wheel, which wanted that balance of keeping people well mentally, physically, emotionally, and spiritually. And even Tommy Douglas had said, part of Medicare was Medicare had to be keeping people well, not just patching them up when they get sick. And here at Native Child and Family, it's actually trying to keep not only individuals well, but their families well and their families intact. And I think that is what we've learned for such a long time about the importance, and with Kevin's help, the importance of secure personal cultural identity. When people get back in touch with their language and culture, how they make healthy choices, how they are able once again to get onto a good path. So we are really grateful to be here with you today in downtown Toronto, but being able to see firsthand the amazing work that you do here to support Indigenous children and their families here in Toronto, and the huge numbers of Indigenous peoples that live in our cities across the country, and how we have to have culturally safe and trauma-informed ways of dealing with this extraordinarily important population. So it's just always an honor and humbling to meet with you and to learn from you. And as you said, Jeff, COVID has been tough. We're currently going through a parallel pandemic of mental health challenges and the overdose crisis caused by the illegal toxic drug supply. La stigmatisation et les lacunes en matière de sensibilisation, d'éducation, de services de santé mentale et de dépendance rendent cette situation déjà dangereuse encore plus mortelle. Disproportionately, we have seen the impact Indigenous and racialized communities across the country. Des milliers de personnes sont mortes. Ce sont les membres de la famille, de collègues, d'amis et de voisins. And as we know, the people like you in the front line, these are people people you love, people you serve, and people who are no longer with us. And so I think recently we've been somewhat appalled by the irresponsible dissemination of completely untrue information about harm reduction and safer supply amidst this crisis. It is imperative that we work to replace judgment and disdain with compassion and respect. Last week in National Addiction Awareness Week, the theme was a community of caring. We actually have to understand that every single Canadian has a role to play. And I think just coming back down into downtown Toronto, that when you see someone who's intoxicated, and ask what's the matter with them, you have to know you're asking the wrong question. The question is what happened to them. And that's why dealing with trauma informed and the effects of colonization, we have to have everybody aware about really the path to sort of a difficult and now dangerous behavior because of the toxic drug supply, and how we can meet them where they are with the spirit of compassion. So we're just so grateful to the people and organizations like Native Child and Family that working behind the scenes to save lives and reduce the stigma towards people who use drugs. And it is with your help that we continue the conversation about harm reduction, to close the gaps in awareness, and to meet people where they are, and to try and keep families together. So we are, as we all, I think all of us here, including the wonderful project on spine health, working with Indigenous peoples to create real change. Nous travaillons ensemble pour nous attaquer aux causes profondes de fardeaux disproportionnés qui portent les Premières Nations, les Métis et les Inuits, les méfaits des traumatismes intergénérationnels, les effets de la colonisation, le système de pensionnat, le changement climatique, la pauvreté et le manque de logement stable. So that's why we're here today. The funding we are announcing is nearly $10 million for 16 projects across Canada to support Indigenous communities for substance-related harms. These 16 projects funded through Health Canada's Substance Use and Addictions Program, SUAP, will directly support Indigenous people at risk of substance use, harms, or overdose, and allow organizations like our hosts to implement innovative community-led projects to serve the many communities and people who need them. Depuis 2017, plus de 300 projets à travers le Canada ont été financés par le biais du programme sur l'usage et les dépendances aux substances. These projects, like the ones we're here to talk about today, are making a difference in community here in Toronto and across the country. We know that to address substance use harms and addictions effectively, we have to take a comprehensive, compassionate, and united approach. Je sais que toutes les personnes présentes dans cette salle aujourd'hui contribuent à insuffler cette dynamique positive de changement. Together, we will save lives and build healthier and better and future for Indigenous peoples and their communities. Thank you. Merci, Miigwech. And now I'm like to invite up Melissa Hamonic, Director of Holistic Services here at the Center, to talk to you about their project that's being funded today.
Merci, Minister Bennett, for sharing about the importance of this work, and thank you for the introduction. We all know that First Nations, Métis, and Inuit people are continuing to experience the ongoing impacts of colonization. We know about residential schools. We know about the trauma that continues through our families to this day. And we know that that impacts not only the physical well-being of our community members, but emotional, spiritual, and mental. And we know that all of those are connected. And when we look after one of those quadrants, we make available the space for community members to work towards healing spiritually, mentally, and emotionally. The Health Canada Substance Use and Addictions Program, SUAP, makes it possible for us here at Native Child to provide critical and culturally grounded healthcare services that are trauma-informed and very much speak to who our community is in this space across the city of Toronto. Community members accessing these services continue to be disproportionately impacted by the COVID-19 crisis, and including the ongoing and escalating opioid crisis. With the SUAP funding, we're able to provide responsive, holistic support focused on harm reduction within an Indigenous context. And I'd like to share that harm reduction has been something that our communities have been practicing for millennia. And this funding gives us the ability to really bring that to the forefront and to bring that to a focus for all. Our program specifically has given us the capacity to create a harm reduction program that's designed and delivered by Indigenous people with actual lived experiences, who are then able to reach out to one group of our community members who are most at risk, which is the age group of 16 to 29. And what this allows is for them to provide their wisdom and their guidance and harm reduction strategies, wellness strategies, so that they can make better choices for themselves, for their families, and for their communities. Another aspect of the work that we are taking on through this funding is that we are creating and delivering a culturally driven, trauma-informed, land-based harm reduction training curriculum. And this curriculum is meant to be delivered to all of Native Child staff and other partner organizations. And our hope is that this curriculum and this training will normalize conversations on what harm reduction is and will make accessibility to harm reduction strategies available to as many people in all communities as possible. And I cannot stress this enough. Harm reduction is healthcare. And the more that we have conversations around normalizing this, the better our communities will be able to make healthier choices for themselves, for their physical well-being, toward healing their emotional, spiritual, and mental well-being. We're grateful that Health Canada recognizes and supports the need for Indigenous harm reduction healthcare models, and we look forward to our continued work together. And with that, I feel compelled to share a personal story. My uncle passed in the heroin crisis in the 90s, and I can't help but think if harm reduction was a conversation available to our communities in the way that Minister Bennett's focus has made it to the forefront, we could have avoided that death and so many other deaths. And I know firsthand the impact that programs such as this are having in our communities right now, right as we speak right now. We have our frontline staff on the ground communicating with young community members, working with them on making healthier choices toward healthier communities. So I can't highlight enough that harm reduction is healthcare, and this conversation needs to be continued, the one that Minister Bennett has started. Merci.
Okay, thank you. We're going to begin by asking if there are any questions in the room. Nous commençons dans la salle. Est-ce qu'il y a des questions? No. Okay, then thank you. We're going to pass to the Zoom now for any questions. There. Alors, merci. Nous allons passer à Zoom maintenant pour toute autre question. Merci.
Merci. So we will now proceed to questions from journalists on Zoom. If you are a reporter and you wish to ask a question, please use the raise your hand function. We ask that you limit yourself to one question and one follow-up. Unless I have stated it, please indicate your name and media before asking your question. Nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous êtes journaliste et vous désirez de poser une question.
Wondering if the speakers would also like to return to the podium.
Veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi.
Hopefully sort this out.
Okay, I'm going to give it a couple seconds here. It doesn't look like we have any questions here on Zoom, so I will turn it back to you, Lori, in the room to conclude the event. Hello, can you hear me in the room? Hi there, can you hear me in the room from Zoom?
For their brochures, there will be no podium pictures of people talking at people.
Okay, there's no
Listening pictures.
There's no questions, so that will complete today. Thank you. Il n'y a pas de questions, alors c'est fini maintenant. Merci. Thank you.